A very good afternoon. I'm going to present the clinical usage of pattern of fixed dose combination of Pregabalin and not combination. Patients having a different kind of neuropathic pain, different. This was a retrospective study. As you know, pain is a very subjective matter and it is complex. And again, it is emotional to patients. When we discuss about the neuropathic pain, whatever the ISSP defined, it is because of the lesion or damage to the somatosensory nerves. And if we see in India, the prevalence range from 0.05% to 24%, and in general population globally, it is around 7 to 10%. The study was basically the objective of the study was to understand the utilization pattern. So what we have objective primary was definitely the utilization pattern, where the two different strength of Pregabalin 50-75 milligram along with the Nortriptyline 10 milligram was taken for this study, and we assessed its utilization pattern and also the clinical global impression related to its effectiveness and the safety in the real world scenario. So as we know, for the if we see the pharmacotherapy of neuropathic pain, there are different drugs which are used, but commonly the SNRI, tricyclic antidepressant, gabapentonates, a class of the drugs which are the primary drugs for this. And if the patient is not getting the substantial improvement, majorly 30 to 50% improvement in the neuropathic pain condition, then we include the different drugs. So the guidelines which are there currently definitely are morely focused on the monotherapies. So there are challenges with the monotherapies because 1/3 of the patients do not completely get relief from the symptoms related to neuropathic pain. Many of the patients have not just a neuropathic pain, which is a cumbersome and affecting the quality of life, but again they have the muscle related problem, numbness, tingling, and also there is they are not able to do the daily activities. So many of the patients, around 50% of cases, not a single drug generally works, and in practice you definitely need to add some other drug which is having a different mode of action to control the pain and pain severity and definitely to provide benefit and relief to the patient. So when we see the current international expert consensus also, what is suggestion is definitely start with the monotherapy and go to the higher dose. And if the patient is not getting the relief or the pain is refractory, you again add some other drug. So that is the common direction which are there in the clinical guidelines. But what we see, definitely more of the drugs, definitely with a higher dose, we see more of the adverse effects, particularly in case of gabapentin, like pregabalin and gabapentin. So if you see the recently published this consensus also, because the major of the earlier guidelines are morely talking about the single drug as a monotherapy for the treatment of a neuropathic pain. But if we see the combination therapy, this recently published consensus also, 87% of the expert believe that definitely the combinations can be added, because in real clinical practice, you can't wait for patient to respond to. And if the patient is complaining of adverse effects, definitely you need to titrate the dose or you add some other drug which is having a different mode of action. So that will be a multimodal kind of analgesic approach in this. So in this our study, definitely this combination is available and approved in India, because in Western world it is not there, but yeah, we have some combinations which are used in this. Then methodology, we had around 73 sites, because the time period was for 1 year. We have removed the data where either the data were incomplete or some of the details were missing. All those data, so around 750 patients data we collected in a year, but out of that only 465 patients data was included, where the patient is the different kind of etiology, and all this data were again captured from clinical sites, from the medical records. Independent coming. Adult patients having a different kind of etiology. So in our results, after what we have collected the data, majority of the male patients were the part of neuropathic pain, and the mean age of the patients was 54, 54.2 10.6, and if you see the range, it was morely 45 to 60 years of patients were the were the part of this study. You see the severity. What we found in our study was majorly 65% of the patient had a moderate to severe neuropathic pain at the baseline. In a finding, if we see the prevalence of different kind of etiologies of the neuropathic pain in this patient, EN was the major, around 31 for study. This is the 31. Apart from that, spinal related, either lumbar or cervical radiculopathy, where the patients were there. And if we see the common symptomology which the patients were presenting, was related with the different kind of numbness, either shooting pain or the paresthesia, dyesthesia were there. But if we see the prevalence wise, numbness and shooting pain were the major symptoms which the patients presented at the time of a baseline. In our result, the different finding, if when we checked the previous treatment history of the patients, majority of patients were on some kind of a monotherapy, and only 10% of patients were naive. What this indicates that many of the patients are on monotherapy but not getting adequate pain relief, and some patients are naive. There also we need to include this kind of so this combination of pregabalin nortriptyline was used in more than 90% of cases in this, and the frequency was once daily. And at the end of the 1 month, the CGI clinical global improvement effectiveness and tolerability was assessed. There was 78%. So around 20% of cases had an excellent tolerability as well as the improvement in the pain severity. And the safety only 33. I know it may be the recall biasness, or it is a recall was poor. So in this retrospective study, only 33 adverse effects were reported. 16 cases were of a mild intensity. Moderate was again around 15. So there were no cases of serious adverse effects were reported in this study. The most common dose was 75/10, and this was more. So what we found in this, definitely the neuropathic pain is a challenging and complex condition. Definitely to achieve adequate pain control in the patients, many times we in practice need to include more than one drug for the better pain control. And 75 milligram of pregabalin plus 10 milligram of nortriptyline was commonly used. The lower strength 50/10 was not to that much extent was used in the clinical practice. And this again is in combination, is again indicating that in real world practice we require the combination of therapy. So in practice we see the doctors or the clinicians do prescribe this kind of combination to patients when the pain severity is in moderate to severe, or if there is a tolerability issue with the higher doses of a single drug. So this is the why this study, because it again indicates that, because more of the guidelines still indicates about or suggest about the single drug, but definitely the way forward is the combination of the. Thank you.